This is another interesting edition of your favorite program, Health Affair, a platform where we beam searchlight on public health issues, challenges of women and children, providing lasting solutions. I am your regular anchor, Ushuomowa Daniels, and you are welcome. 4th February 2022 was World Cancer Day, an opportunity to raise awareness about the scourge of cancer. This is the focus of this week's edition. We'll be right back after our news segment. Please stay tuned. The new president of Pharmaceutical Society of Nigeria, Professor Cyril Osifo, has called for the cooperation of the media in his mission to improve healthcare delivery to Nigerians, especially with regards to pharmaceutical best practice. Professor Osifo made this known during a chat with newsmen in Lagos about his formal inauguration and fellowship investiture holding on the 10th of February 2022 at Transcorp Hilton Hotel, Abuja.
It's the first time a serving academic person, a professor, still in the service, will be the president of the society. And it's also the first time that University of Benin is producing somebody as head of PSN. But interestingly enough, we will also be inaugurating the past president. We have past presidents who have served, and some of them will be coming. One or two of them may not be able to come due to age or ill health. We will decorate them at their homes. And then we will also now invest about 110 fellows who are worthy of such honor.
It's a glorious day for the new fellows, and especially for our president, Professor Cyril Osifo. It's been a while since we had an academician as our fellow, as our president, and we're all here to support him. The event is well planned and organized. I'm the chairman of the organizing committee, and we're expecting quite a lineup of dignitaries.
Osifo noted that his pact with his colleagues was encapsulated in the 5-point agenda as follows.
A. Institutionalizing the PharmD program and the consultancy cadre agenda to enhance service potential and catalyze an increase in the ways of hospital and academic pharmacists. B. Promote advocacy to fast-track recognition of communities' pharmacies as primary care centers in accordance with the National Health Act of 2014. C. Boost local productions for manufacturing of essential medicines, including vaccines, while ensuring availability of medicines which cannot be manufactured by local industry for the health system. In addition, I will also ensure significant improvement of research and development by looking for alternative source of funding apart from government sources to NIPRID, Faculties of Pharmacy, DRPU's Center for Drug Development and related platform. D. Establishment of a National Postgraduate College of Pharmacists to complement our consultancy cadre agenda, while also working with NAFDAC, Pharmacists Council of Nigeria, and relevant stakeholders. It is the purpose-driven interest groups like Lady Pharmacists Group Apps, SIPAN Clinical Pharmacists Association of Nigeria, and the Young Pharmacists Group, the PSN YPG Group. We will be adequately giving due attention and well motivated. We will ensure central placement of interns and gainful employment and facilitate opportunities for all of them. Furthermore, we will engage positively various arms of government through advocacy and diplomacy. As president, I strongly believe in teamwork and will ensure that I delegate duties where necessary and monitor the implementation as such. Within the last 2 months since we assumed duty, we have been able to collaborate with appropriate agencies and community pharmacies, which are now centers for COVID-19 vaccination. The pharmacy consultancy cadre has also been firmly established. More schools of pharmacy are undergoing accreditation for the PharmD program. Over the next couple of months, my team, including my secretary here, publicity secretary, the treasurer, assistant national secretary, and other members of the National Executive Council, we shall make sure that the following issues will be in the front burner under the presidency of PSN. We ensure improved relationship with government, both the executive and legislature, to ensure the right of every Nigerian to pharmaceutical care. We also make sure we pursue and institutionalize PharmD, like I said, in various schools of pharmacy, and ensure that the National Postgraduate College of Pharmacies complement our consultancy care while working with various stakeholders. We also improve the visibility of pharmacists and pursue the Pharmacy Tour project with all other business concern of PSN.
On the 5th of November 2021, during the 94th conference of PSN held in Port Harcourt, Rivers State, Professor Cyril Osifo received the mandate of his colleagues to direct the affairs of the society as president.
When it started, it was about 3 months when I lost my wife. 2, my job was at stake because nobody to stay with the child, and which eventually happened. I stayed 3 months with him in the hospital.
A father of a child with leukemia, otherwise known as cancer of the blood, there sharing his experience, a very sad reality for him and several others who had hitherto believed that cancer was a disease of only the elderly. The financial involvement and trauma that comes with cancer, including other challenges to affected families, is better imagined than experienced.
I have 2 cars. I have to take it out immediately because I was not having cash with me, so that I can have money to treat him. So I have money, I start the treatment. I was thinking that it's a very easy thing. The money is going to be enough for me to treat him. I start treating him, chemotherapy, everything we start doing. Along the line, I run out of cash because I dropped my job totally.
According to these experts, cancer is a major barrier to increase in life expectancy in every nation, especially developing countries like Nigeria.
There's no continent or area where you don't have individuals who are prone to having cancers. Using the global statistics, we have discovered that in some places you have some cancers that are commoner than others. This can be attributed to their socioeconomic status, can be attributed to their wellness checks, and you can also attribute it to sunlight in some areas more than others, and so many other factors. So when we look at the statistics, we'll see that cancers that are common in Nigeria includes, for females, you have breast cancer as the commonest female cancer, followed by cervical cancer. For men, prostate cancer tops the list. Other cancers that we have that are common in our environment includes colon cancers, lung cancers. This is a bit different from what you have in the Western world. In the Western world, yes, they have more of lung cancers. Their commonest two for cancers is also breast, followed by lung cancer, cervical cancer, and colon cancers. So different groups have different countries are prone to different cancers. In the Western world, we also have a lot of skin cancers because of their exposure to UV rays. But for us here, we don't have a lot of skin cancers. In the developed world, we also have a lot of children who have leukemias. Leukemia is a blood cancer, but here we do not have so much of leukemias. We have a few children who also have blood cancers, but they are not as common as what we have in the Western world. So the key is this. So we have areas where we can identify and say that these cancers are common. And so when you know these areas, you watch out for those things in that particular area.
To achieve the 2022 theme of closing the gap in care, they want the relevant authorities to go beyond the rhetorics of the annual celebration and invest more in comprehensive health care for cancer patients and awareness campaigns.
All age groups can have cancer up to the age of 90. Newborn babies can have cancer. If you have children that you see anything in them or they're complaining, you make sure you look into it, and as a parent, you take them to the hospital so that a comprehensive investigation can be done, and also for the adults.
The situation today is not very good because most of the cancer patients present late, and there's need for awareness because we need to raise the level of awareness and let people go for screening, do the right thing so that they present early if they have the diagnosis and we can quickly treat them. Also, treatment of cancer is a bit exorbitant, and we need to be able to pave way for payment of cancer treatment. And one of the ways that that can be achieved is to improve the health insurance scheme to cover cancer treatment. If we can get treatment through health insurance, both the chemotherapy, radiotherapy, and surgery for cancer treatment and cancer patients, I think that will go a long way to increase the curability, and also it will improve the prognosis of cancer patients in Nigeria.
World Cancer Day is celebrated 4th of February every year to educate the public about the signs and symptoms of cancer to ensure early detection.
The Lagos State government has revealed its plans to screen 100,000 women for breast and cervical cancer annually free of charge. The Permanent Secretary, Lagos State Ministry of Health, Olusegun Ogboye, who disclosed this, added that free screenings for breast and cervical cancer has since commenced in 62 state health facilities, including designated general hospitals offering gynecology and obstetrics care services and flagship primary health care centers across the state. He encouraged residents to engage in periodic screening and lifestyle modification while raising awareness for early management of cancer. In her determination to ensure the safety of the populace, Dr. Siju Iluyomade has for the third time in few weeks put together another free COVID-19 vaccination for people around Lagos and its environs. The vaccination, slated for Wednesday, 9th of February 2022, will be open for those who have already taken the first dose and those who have not. The most effective vaccines from AstraZeneca, Moderna, and Pfizer will be made available. This is an initiative aimed at assisting the government in addressing the shortfalls in designation of locations for people to get vaccinated against COVID-19. The Apapa Command of the Nigerian Customs Service intercepted a container of unregistered pharmaceutical comprising codeine syrup and co-caps with duty paid value of 78.8 million naira. The controller, who made this known, said the collaboration with NDLEA has helped in gathering intelligence, leading to the seizures of prohibited items at the command. The collaboration also aided in swift action in reliable information without waiting for importers to come forward before effecting examination on suspected cargoes. The NDLEA commander in Apapa Port, Samuel Gadzama, promised stronger synergy with customs to prevent such importation.
With the stories of emergence of Lassa fever across the country is a story of caution and anticipation from the officials of the State Ministry of Health in Gombe State. According to the officials of the Ministry of Health, although the state had a history of cases of Lassa fever, there is no positive case of the fever recorded this year.
The whole of 2019 was the peak period we had. 2020 and 2021 was minimal, and in 2022 now, since the beginning, we've not seen one case of Lassa in Gombe. We've not seen one case of Lassa since beginning of 2022.
However, data supplied by the Ministry of Health shows a cautionary approach the ministry is taking to monitor the emergence of Lassa fever.
Say that we don't have any case in Gombe State yet because we are looking for those cases. We have been on the lookout for those cases because we have a heightened situational awareness for Lassa fever. We've received notifications from the Nigerian Center for Disease Control. And what we did here at the EOC is we tried to ensure that there is an IMS ready for it to be activated almost immediately.
Officials of the State Ministry say accreditation of its molecular laboratory used in detection of COVID-19 virus to test Lassa fever is essential for the people in the Northeast.
Laboratory team at the NCDC and other development partners will have to come, assess the laboratory, assess the personnel in there and the equipment, and then upgrade it. Right now, Gombe is on level 3 laboratory, and we are on the way. We will do that. The Gombe is strategically located in the northeast. Would serve as a referral laboratory for all these things.
For now, the officials of the ministry say they are watching with caution to detect and treat cases of Lassa fever in the state. It's another year, a time for the state governments to prepare for the outbreaks of diseases with the transition of weather and changes in climatic conditions. In Gombe State, officials of the State Ministry of Health say it's a case of anticipation due to the experience it had a few months ago.
It has prepared in earnest. We're prepositioning essential drugs to combat that. Particularly also is the public health system in terms of the human resource. When issues such as this come, there's the social mobilization pillar where we make health education and promotion, tell people how it comes and how it is prevented. Then there's the management pillar. Then there's the laboratory pillar where we do investigations to confirm and declare outbreaks.
Last year, the State Ministry of Health had declared an outbreak of cholera in Gombe local government area with 48 positive cases. However, this time, the State Ministry of Health say there were no cases of cholera or meningitis in the state.
We divided the state into 5 zones actually, and then in each of these zones we preposition antibiotics and other commodities for collection of samples for testing whether it is meningitis, that is lumbar puncture kits. We preposition all these things so that if any clinician in any of our facilities suspected meningitis, he is trained to collect the sample so that we can test it.
The State Ministry says it has set surveillance mechanism to detect cases that come from neighboring states.
Welcome back. The World Health Organization, WHO, estimates that more than 30,000 children are diagnosed with cancer yearly in Nigeria. An estimated 28.4 million new global cancer cases would occur in the year 2040. That is a 7% rise from what it is now. There is an increase in all types of cancer cases, with no one spared. I spoke with some experts about the challenge of childhood cancer, other types that affect adults, and the new concept of holistic care, and lots more.
Sometime in 2012, a dear son of mine, a friend's son, was diagnosed with cancer. I think he was 14 then, and that was too much for us. Lut became our second home. I mean, we were all devastated, me and my friend. And we were not following now. But along the line, I had this burden. I think it was God that put that burden in me to empathize with these children, because in Lut, you have quite a good number of them. As young as a 6-month-old Ayo was diagnosed with cancer of the eye, and she later on passed. that became a burden. And at the time we were able to incorporate Children with Cancer Intervention Initiative. And so the NGO has been there for them to assist them, support them with prayers, with treatment, the much we can, and with facilitating some of the areas that we can call in the government to do something. For instance, in Luth, we discovered there was no oxygen piped into the oncology ward where the children are. And at that time, these children, most of them died because there was no oxygen. And so what we did was to then, we went through the medical director's office, and then they got to know who we were, and then we carried it on and then got a quotation for the cost of piping oxygen into the oncology ward in Ward B, Luth. And when we got that, we now made our request through the office of the Ministry of Health, and then we'll attach the quotation and we'll say, with no recourse to us, we just want this done for these children. And to the glory of God, they did. After the piping of this oxygen in the oncology ward of Luth, we now got information from the parents that they were paying 5,000 naira per day. Then, I don't know how much it is now because I learned it's gone up. And then we wrote back to the ministry, we say, why are we charging these parents or these patients this amount of money? They try to intervene because we have letters. They try to intervene, but at the end of the day, the decision of the hospital was taken, so they continued the charging. But what I'm just saying is, there's a lot that the government has to do, a lot, because I have to start from the government before I go to individuals. This is a big problem in our hands. The menace of cancer, we'll call it dreaded disease. Sometimes you get to the hospital and the nurse will ask you, do you know what this child is suffering from? Which means to them too, it's too much. It's a big, big problem. So it is a problem that not just an individual can handle. It's a problem that government, corporate entities, everybody, we must team up, we must collaborate to bring this thing down. Otherwise, cancer is ravaging. Cancer is like sweeping across the length and breadth of human life. And then we need to do something. Government must find a way to augment the treatment of those that are already down with cancer. And then there should also be a way to prevent it. Some of the cancers are preventable. Some are environmental. Some are by what people eat. Yes, just maybe 1 or 2% might be hereditary. And so government has a lot to do. That's the kind of thing we're doing to create awareness. A lot of people, when we started with children with cancer, people didn't know children go through cancer. They thought it was a disease of the adult. But now, some people are realizing that children can come down with cancer. And again, we also did a letter to the Ministry of Health then. And we're also calling on Ministry of Health now. We wanted a situation where you can make donation of blood so easy for people. Like you can come to my office and take my blood. And then I don't need to go to any hospital to donate blood. If they do that, people know, you can make a call. Just call SYC. Please come to so and so and take blood. And it will be easy because these children, the oncology ward, they need blood. And there should also be cancer screening centers all over. It can be in every local government in Nigeria, in 774 local governments in Nigeria, so that it's easy to detect, because early detection of cancer will seriously do a lot.
If you look all over the world today, the cancer control, cancer treatment is shifting from the very conventional part, conventional method of just addressing the body. There's what they call the holistic approach now, which the UICC, that's the Union for International Cancer Control, is promoting, to say that, look, you address the whole body, the whole person himself, spirit, soul, and body. And what they do mostly now is taking the cancer patients even outside the traditional hospitals, get them somewhere where they address their soul, they address their spirit man, even before addressing their physical body. And that's talking about telling them about God. Putting reassurance in them to say that, look, there's nothing that is beyond God. Bringing their faith level up even before they begin to address the body. And it's really working because as of today, the World Cancer Day for February 4, now they're saying that the percentage of casualties that comes from death is gradually reducing to about 40. About 2-3 years ago, it was almost 65%. But now they said it's coming down to 40. And it's because of this tripartite approach to whatever, addressing the soul, addressing the spirit, addressing the body. And that's why we also now concentrate upon to say that, look, when we get people like that, speak to them, talk to them, let them know about what God can do, let them know about what God had done before and what he can still do, so that when you lift that up, even when the medicine or the drugs or the chemo now comes in, he finds a stable mental stage, to approach. And so we've been getting results from that. Trying to combine everything together. We've not gotten to the level of all those places where they have specialized places. For instance, there's a place called Hope for Cancer, somewhere in the United States, a village there where they take them to. And what they do is those who have survived cancer, they were their regular people outside of the medical people. They were there too. So when you come in first, they are even the first set of people that you see, not even the medical doctors. They will tell you, what's your diagnosis? This is it. Okay, I have this. Mine was even worse than this. This is what I went through, and this is how I got out of it, and all the rest of them. So they will have given them that hope, which our normal hospital don't give unto our patients. Get to the hospital there. They treat it as if it's a death sentence. Imagine a senior nurse asking the parents of a child, do you actually know what your child was diagnosed of or is diagnosed of? Are you sure you know? So what are you doing? They heighten the fear, they heighten everything to the point that it's almost like I said, a death sentence to those people. And when it happens like that, there's very little that drugs could do. So they now discover that rather than approaching it that way, let's get them to a point where they share experiences with those who have been there and those who have survived it. And they don't even leave those who passed on through it. They will still tell them that what people still do pass on with it. But they will now begin to tell them how to go about it. And that's why in our organization here, we talk about the fact that cancer is preventable. Cancer is detectable. Cancer is treatable. And that globally, we can overcome cancer. That's the essence of the World Cancer Day itself. And that's why the theme for this year is Close the Gap. What do they mean by closing the gap? You discover that there are some barriers to cancer treatment. It could be economical. We heard from the parents there. They weren't detailed enough. If they are, you will know how enormous the finances that is involved. So you discover that when you say you want to go the conventional way, the way it's being done now and left to the private individuals to take care of them, how many people could get in there? I have a friend that's just coming out of it now. He was telling me the last time that, not our government hospital, a private hospital, that there was a drug, an injection that he was taking 1 per week for almost 580,000 naira. Yes, 1 per week. That's not to talk about when he sleeps over in the place, it's running to about 1 million. per one night. And so most times you find out that people resigned to fate. Those who goes to herbalists and all that, it's not that they wanted to, but when they don't have the means of doing it, what do? That's why they go back there. And that's why we are saying that, look, if it is preventable, let's start from there. Let's reduce the number of incidences first. And why is that so? Because we discover from statistics, not we anyway, from statistics that we have, that 90 to 95% of cancer incidences comes out of environmental and life factors. That is, where you find yourself, where you live, the kind of life that you live, and whatever. So if we can begin to educate our people based upon that, look, these are the risk factors. If you don't do this, it's likely not going to get to you, although the children know most of them comes from hereditary, whatever. They got it from their parents and that. But for older people, and if we can prevent the older people, that means that they will be passing cancer-free genes onto the children that are coming up. So we discovered that there are so many barriers like that. Economic is there, sometimes traditional culture, sometimes geography. I mean, one is not saying anything against this country if we say that for our side of the world today, our approach to cancer is still so rudimentary, so archaic that it's nothing to write home about. In other climes, I mean, oncology department or whatever they call it, cancer hospitals are not part of the traditional hospitals. They are separating them now to take them away from even the what do they call it now, stigmatization that usually comes to them. You see cancer patients and it's like, even the expression on the face of the doctor, the expression on the face of the nurses, it's like, no. It's like you are gone. So they now have well-trained people who approach the issues from the perspective of hope to say that, look, no matter what it is, there's still hope. Then getting away from the preventive side, we're now talking about detection. I mean, part of the slogan today is that cancer can be seen far away off. There are so many technology now that is available. I mean, in those days, you have to cut part of the the cells that are overgrown and what's not to detect. But today, even from saliva, they are getting it. Even from the blood, they are getting it. So it's just a matter of checking you getting your blood and it gets to know whether the cancer is there. So it's not something so complicated today to say, okay, we have to go for surgery before we know that you have cancer. Those are the advancement that is taking place in the cancer treatment, which we say that, look, the only way we can get it to this side is what the UICC, like I said, is introducing the concept of World Cancer Day, which is a day when the new innovations, the new developments, the technological advancement is now introduced to the world through new publications and everything. That's the essence of the World Cancer Day. I mean, to increase the awareness of the people, not just about the sickness of the disease, but about how it could be treated and whatever. So that's why we are saying that we are more into advocacy, letting people to know that, look, this problem is there, but it's not just there. There are solutions. And outside of the solutions that is conventional, that also addressing the spirit man through prayers, I mean, through encouragement, I mean, through the word of God. And when you believe that the Spirit of God will minister upon the words that people go away with so much faith to say, I am going to get healed. And such people, most of the time, get healed. Not because there's any magic to it, but you are introducing a God factor there to say that, look, I believe God will do it. And I think the first case that we have here was almost a written off case. Before the organization stepped in, if you are sick, I think the most sensible thing, first of all, is go to get to the hospital. Because even if you are going to pray, there must be a name that you are addressing. So you go to the hospital first. The church is not the first place of call. Yeah, I know that in your normal, regular prayer, you pray for healing. You pray for divine health, not even healing now. You pray for divine health. God, don't let me get sick. But when you are sick, you go to the hospital. When you now get to the hospital and they say, this is what is wrong with you, and there's a limit we can go about this, then continue with that conventional method of treatment, then you apply prayer to it. You do apply prayer to it. Why? Because even if you check the Bible, we'll discover that the origin of sicknesses and diseases are not even physical. They are very, very spiritual. I mean, 2 or 3 times in the Old Testament where God mentioned the covenants of healing, there's an aspect of, if you obey my words and you do what is right before me, I will not put these sicknesses and diseases upon you like I did upon the Egyptians. And when he was talking about Jesus Christ coming for healing, he said, by his stripes you are healed. What is the meaning of the stripes? The stripes he took for the sins of the people. So the foundation, the bedrock of sicknesses and disease is the sins of the people. I mean, if it is a church setting now, we'll know how to explain it further, that most of these hereditary things that we are talking about, even in medicine, not just cancer, there are other sicknesses and diseases that medicine will tell you that they don't even know what caused it. They don't know how to treat it. What we can just do is to manage it so that it eventually goes, or you eventually we can prolong your life. Immediately they are calling it, they call it idiopathic sicknesses and whatever. What they are saying is that we don't know what is causing it. Researches have been done, scientific whatever has been done. We don't know what caused it, but we have a management procedure for it, which is what they do for cancer. Even when they say that cancer is finished in your body, you go for the test, they will still say, look, if it doesn't come back within 7 years, then you are sure that you are totally healed. So for that 7 years, you are seeing whether it will come back or it will not and whatever. And that's the spiritual side of it. That look, these are not seriously medical issues. They are spiritual issues. But first of all, go in there, let them say what is wrong with you. You could pray from today till next year, and your prayers may not have any revelation to say you have cancer or whatever. The malaria will still continue to come back. The body disabilities will still coming back. I mean, so you won't know what to address. But when you go to the hospital first, and the hospital now says, fine, this is what is wrong with you. And then we can now call people together to say that, look, let us come and attack the foundation of this issue. And that's why even in attacking the foundational point of the issue, we ask some questions, which even the medical world they are asked. You get to the hospital now, they say you have cancer, they ask you, has anybody been diagnosed with cancer in your family before? Has anybody died of cancer? Has anybody survived? That's to trace it through the spiritual gene now to say that there's some connections somewhere within families, within generations that could have caused it. I mean, today we know that maybe the church has bastardized some slogans, generational causes. We have overused it, and people are profiting from it and whatever. But these things are real. They are real because God himself said, he said, if you obey, and when you don't obey, naturally there's what we call the curse of the law. And the curse of the law, if you read Deuteronomy 20:25, most of them are sicknesses that comes after. But you need to know what you are talking about. I mean, if you come to me and I say, okay, I'm a pastor, let us pray about this sickness. I mean, it would be very, I don't want to use the word stupid for me to be expecting that God will now call me and say, what he has is cancer, what is this? I will pray generally. But if it persists in now or whatever, that is when you now think that is why we now say, you go there first. And when you get in there, come back and tell us what name they call it. And one experience that we also had at a time about a sister that had that, even the tradomedical place that they took her to, they referred her back to the hospital, say, tell us what type of cancer does he have. In fact, they were requesting for a blood whatever so in cotton to take in there. So both ways, we must first of all know what we are addressing before you now say you begin to pray. And beginning to pray does not mean you abandon the conventional thing.
Thank you for coming on the program. We appreciate you. Just joining us, it's Etafe on AIT. Next on the show is our nutrition segment, an aspect of the program that preaches the need to eat right for good health.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folate content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation, reduces bad cholesterol, levels the risk of diabetes.
Please come with me to our clinical segment for tips on healthy living.
Symptoms of cancer generally are non-specific, and they are particularly related to the area of where the cancer is developing. So if a woman has breast cancer, we'll be looking at a breast lump, swelling in the breast. If it's cervical cancer, we'll be worried about things around that area of the woman's body, which is in the private parts. And we would not want to stress on the symptoms, because by the time women are noticing these symptoms, it is too late. That's why the focus is on prevention. Before the symptoms start appearing, women should turn up and do screening. Let us, the doctors, the nurses, pick up the signs, the issues that may be going on in that person's body, whether it's the breast or the cervix, before the patient starts feeling the symptoms. But for academic purposes, people ask what are the symptoms of cervical cancer. I can reel them off on my fingers. One is a discharge that is not going away. Bleeding. Women are supposed to bleed periodically. That's why we call it period. But if it's no longer periodic, bleeding every day, everywhere, anywhere, it is not acceptable. Bleeding after intercourse. Women are not supposed to bleed after intercourse. We call it postcoital bleeding. It's a sign of cervical cancer that there's a problem. Women bleeding after menopause. When women finish their period, they reach a stage called menopause, the end of periods. But women start bleeding again after they already said bye-bye to period. That's called postmenopausal bleeding. When the cancer has now advanced away from the cervix area, it can now start affecting the pipes, draining urine from the kidneys and cause total blockage of urine passage. That is the final stage, and that is not acceptable.
You know, I don't truly understand why people are against the vaccination. We're always vaccinated. We vaccinate all our children. They get measles, they get diphtheria. It's by the same people you say want to kill us all off with COVID. I mean, we're buying the same and giving our children. So what's the problem? The other thing they say, oh, it was developed too quickly. Technology has happened. We have better ways of doing these things in a faster way. So I think part of what we're also seeing is politics from other places that we're just buying into without recognizing why some of these messages are coming out. There's a lot of politics between groups in some of the Western world, and they have used the vaccine as one of the areas to fight, and we're just following them without looking at our own situation. What I mean by that is our history of vaccines has been positive. Smallpox, measles, our children don't die because of polio. We don't see it anymore. That's vaccine. So I truly don't understand why we allow a few people who are sometimes mischievous on internet and set messages out, and then do it well to look very, why are we believing them when the evidence before us shows vaccines work?
Government should encourage the dental profession by ensuring that the oral health policy that was passed some years ago is fully implemented, so that every nook and cranny of this country will have a dental facility. we have about 774 local governments, I'm sure. There's nothing wrong in government having a standard dental facility in all the council areas to ensure that people access dental care.
Call the phone number showing on your screen to be a part of our perception segment. Your opinion on how to improve human lives and the nation's health sector matters to us.
It's really important for folks to understand that women and girls have the right to live freely, to grow freely, and to not have to worry about being at risk for violence. Stigmatization, but if you open your eyes, you will see it. You'll see it in your families, you'll see it in your workplaces, you'll see it on the street. It is up to everyone, and in particular men in this country, to actually step up and say this is not acceptable. If you want to be a real, Nigerian and a real man, there's no place in this country for violence against women and children.
If you're able to reach the common woman by telling her, be careful, the amount of oil you use to fry that your akara, for example. Do you understand? This is a better oil to use, this is not a good oil to use, for instance. And then you encourage her to teach her children the right foods to eat. Teach her husband the right times to eat. Encourage her to make sure that they all have adequate sleep. You're beginning to send the message easily, especially when you target women and children.
This is where we'll wrap it up today. Please join us same time next week for another interesting edition of the program. Health Affair is a veritable platform where you can advertise your products and services for a good mileage. It comes at a very cheap rate. Please advertise with us today. My name is Usho Mowa Daniels. Please keep staying safe.